Okay, folks, we're talking about Chapter 9, which is talking about two major topics, two major concepts here, infectious diseases, and really the ins and outs of those, and the term epidemiology. So we first take a look at some terminology here. Infectious diseases as any type of illness caused by a pathogen. Epidemiology is actually the monitoring and controlling of the disease and when it happens and how it happens, and really the end goal is to promote public health, right? And so we look at these diseases, these infectious diseases, right, and when they happen and how often, right, to promote then public health. And again, this is one of the major goals, or one of the major ways that, you know, healthcare clinicians can actually promote health of their patients, right? Is really looking at this epidemiology. And you as clinicians later on in the future will get your fair share of looking at this data, and then it's up to you. You know, you're promoting the public health here. You're the person that's out there on the front lines talking to patients, promoting this as well, right? So we talk about disease, but disease actually means disease can come from infection of a pathogen, but it can also be other diseases that are not caused by pathogens, right? Cardiovascular disease, diabetes, cancer, and many others. So epidemiology really covers both, not only just the infectious disease, but other. So when we look at actually pathogens, we've got 6 groups, right? And this goes back to the beginning of this course, talking about each one of these, right? So we knew that there was actually these groups here, if you will, falling under certain domains and under certain kingdoms, right? And in fact, those can cause many different types of infectious diseases. They give you examples of each one, but I just wanted you to understand that and to know that that there are 6 different pathogens, that all of which cause infectious disease. So in particular, we focus a lot on bacteria and viruses in this course, but there is also infectious diseases arising from others as well. That's evident. So what is an opportunistic pathogen? An opportunistic pathogen will only cause a disease when the host is weakened, right? That's an opportunistic pathogen. It's a pathogen that is pathogenic only when presented an opportunity to do so, right? So what do we mean by this? Yes, a weakened immune system, the host is weakened. That's a great example, right? All right, so somebody that's immunocompromised. But what else? Somebody that's had previous trauma. Somebody that's actually, for example, taken an opportunistic pathogen and put it somewhere else, right? And I give a great example here of E. coli, right? E. coli is found normally in the colon, but if it gets to other places, like other parts of the GI tract, it can become opportunistic, right? So when presented an opportunity, right? Again, We see this in common food infections, food, you know, illnesses, right? Foodborne illnesses where somebody doesn't wash their hands correctly. Remember that story, right? And handles your food, and then you ingest, you know, opportunistic pathogens like E. coli into your mouth and stomach, and that can cause issues there, right? So opportunistic pathogens, when presented an opportunity, right? And a true pathogen doesn't require a weakened host. It will cause the disease no matter if the host is weakened or not weakened, right? Good example of that would be the flu, right? So what is a sporadic disease? That's an isolated infection. So the key word is isolated infection in a particular population, right? And so they give you an example of Ebola, but Ebola is very much located in Africa, in certain parts of Africa, west part of Africa, in fact, is where you see Ebola. And again, sporadic case, right? An endemic infection is one that's routinely detected in a population or region. So routinely or commonly detected. So again, the key word is routine or commonly found. Again, a head cold. That's normally caused by a virus, and we see that commonly. So that'd be an endemic one, right? An epidemic, keyword is widespread, right? And in a particular region. Also in a specific time, right? So that's an epidemic, right? Widespread disease, outbreak, particular region, specific time frame, right? So the flu can also be this, right? Flu can be an epidemic, right? So it depends on the season, right? We've got epidemics of flu, again, depending on vaccine protocol, the choice of the vaccine, and also seasons play a role in that as well. And finally, a pandemic is actually an epidemic that spreads to numerous countries, okay, or numerous continents, right? So when we talk about North America, South America, Central America, when we see epidemics spread to continents, right? Several countries in the continents, or several continents, we see a pandemic, okay? All right, so we look at emerging and re-emerging pathogens, and they're very much linked into an epidemic or a pandemic, right? So when we see an emerging pathogen, this is actually a newly identified agent, right? It can be a new identified, let's say a new virus that we've never seen before, right? That's an emerging pathogen. Or a pathogen that was sporadic and now we see it in more cases, like this example, Zika, right? And again, the reason why we see Zika more prevalent now, we see it coming out more and more, is because of climate change. As we see the weather changing, the earth becoming warmer, we're actually seeing more of the mosquitoes spread to warmer areas, right? Places where, for example, in the winter, we would see a hard freeze and the mosquitoes could lay dormant because of that freeze. We are now seeing those mosquitoes stay longer in those areas and then reproduce much more quickly and faster and earlier. Because of that, we see the spread of Zika. And just to kind of put in context, again, we give examples here, right? So Zika has been found as close as South Texas, the Rio Grande Valley, in particular Brownsville. They had a case of that. And in the Miami-Dade region of South Florida, right? So we've seen that so far, right? Those were sporadic, in fact. I mean, we didn't see an outbreak of these, a big amount of Zika there, but we did see a few cases of people in that area that did not travel and then got Zika there. Reemerging pathogens is an infectious agent that was under control but now resurfaces. Okay? So bacteria that we know that we've treated before with antibiotics that become resistant, that can be also a reemerging pathogen. Another example that we see very recently is measles, right? That could be considered reemerging, right? Where we had that virus basically under control and now it's not under control, right? For the, generally speaking, right? So just a quick fact here, since the 1970s, about 60% of the emerging infections were zoonotic diseases, right? And zoonotic diseases are those diseases that are spread from animals to humans, right? Animals to human. And many of them are what we call non-communicable. They don't spread from person to person, right? So we take a look at these. These are the ones that actually are of most concern so far because we've seen them before in the past. We know that the flu is one of those. Chicken pox, right, or another. Smallpox is a zoonotic disease, and others. So one of the deadliest types of infections that we know of have come from an animal first and then a human. And how does that really work? Right, process of evolution. And one of the processes of evolution is mutation, right? And we've seen this, right? Horizontal gene transfer, right? And if you go back to horizontal gene transfer, you remember that there's several different ways that these, different pathogens can change, right? And in that point of time, they change to be able to interact with cells and tissues and the receptors of cells and tissues on the surface of the, right? So communicable diseases, so we take a look at non-communicable, but communicable diseases are those diseases that go from or transmit from human to human, right? And a type of communicable disease, right, that we call contagious, and the key word is easily, right? It's a disease that's easily transmitted from one host to the next. So that's a little bit of some terminology on diseases and how we actually term them, how we describe or label certain diseases, right? But we can also describe diseases based on what the host experiences, right? And again, for our purposes, what the human, right, is our host, right? What the human experiences. All right, so when a human, for example, has an active infection, right, we say that the patient is symptomatic, right? Or we can say the patient is symptomatic, right? Which means the patient presents signs and symptoms that indicate a particular infection or can indicate a particular infection. But that's not always the case, right? I mean, that's not, in reality, in theory, that sounds good, but in reality, that's not always the case, right? Because those that have experienced this know that many signs and symptoms indicate many different types of infections, or not even pathogenic infections, they could also be underlying diseases, right? So it can be very confusing to particularly identify a particular type of source of these signs and symptoms, right? So again, this is taken as a whole, right? You take this piece, the signs and symptoms, as a piece of the puzzle, but it should never actually lead to a complete diagnosis, right? A complete, answering of the mystery, right? You take this along with other puzzle pieces to see the big picture, right? But these are very helpful nonetheless, right? Signs are very much objective indicators, right? And symptoms are very much subjective, right? So anything that's objective, right, can be measured or verified, which means we have seen these objective signs, we've seen these indicators before, and we know for a fact because of research, because of experience over and over again, that those signs point to a particular type of infection, right? If we're talking about a disease or infection, right? They can be measured or verified. Symptoms, on the other hand, are subjective, right? They're experienced by just the patient only, right? Okay? So that's really what signs and symptoms are, right? So some examples of signs: fever is a sign, rash is a sign, blood and stool is a sign, diarrhea can be a sign, breakouts can be a sign, right? Like the rashes. I mean, those types of things can be signs, objective indicators. It can be measured, verified with previous experiences or previous research, right? Symptoms can vary because it's sensed by the patient. So some patients can actually have these types of symptoms, or some patients do not present those types of symptoms. So they're not always the case in every patient, right? Pain, for example, because people have different pain thresholds. They can withstand pain more than others. Some people are more sensitive than others. Pain can be one of those symptoms, right? Fatigue as well, right? Being tired, okay? And nausea, right? Some people experience these and some people do not, right? So people with latent infections, and hopefully you remember what a latent infection, it's an infection that has not completely eradicated itself from the body, okay? That means the virus is still around, the bacteria is still around, you just don't see signs and symptoms anymore, right? That means asymptomatic, right? Which means it's grown dormant somewhat, and it's going to reemerge again in the patient. And they go through these periods of feeling bad, feeling good, feeling bad, feeling good, right? That's a latent infection, right? This portion of the graph is the latent portion. All right. So acute and chronic diseases really talk about how fast you get the disease and how fast it progresses to actually these signs and symptoms, right? So acute is rapid. That means the time is much faster that you get this disease, and chronic is slower, right? Okay. So really based infectious diseases epidemiology really has its basis on Koch's postulates, right? Robert Koch, which is a scientist that looked at the germ theory of disease, right? He developed these 4 criteria, and this is really the basis of epidemiology and infectious diseases, really how we see this, right? How pathogens are the causative agent for a certain disease, how we link pathogen to disease, right? Which was hard to do. Again, picture yourself in the 1700s or the 1800s. Picture that, and picture different illnesses coming about, different people, not having the modern science behind you and trying to figure out what caused this disease, right? And we took a look at that at the very beginning of this course when we took a look at history, and we saw this, this type of situation. So here's Koch's postulates, right? Number 1, the same organism must be present in every case of the disease. So if 10 people come in, okay, and they have the, you know, similar signs and symptoms, and we took samples of each one and we identified them under a microscope. We saw the same organism for the same disease, right? Number two, the organism in question has to be isolated from the disease host, taken away from the host, and grown as a pure culture. For example, on a petri dish, on a test tube. Okay. The organism in question should cause a disease, right, when it's inoculated into a host, right? So we would take that pure culture sample, we'd stick it in another host, and we'd watch the host progress into that disease, right? Number three. And then number four, the organism must be taken out of the next host, right? And then re-isolated, looked under the microscope, and you'd see the same disease, right? You see the same organism, excuse me. And that's really Koch's postulates, right? Again, this worked at the very beginning of you know, microbiology, but obviously there is a big ethical issue here, right? And where's the ethical issue, you know, more particularly, right? This one right here, right? Obviously that doesn't work in normal medical science, right? We don't go to a doctor's office and the doctor says, hey, I think you're sick with this. Let me pull the sample, you know, grow it on a petri dish, and then, you know, let's take ask one of the nurses to come over here, and I'll give the growth to the nurse, and let's watch to see if she or he gets sick, right? Doesn't work that way. Although research, right, medical research kind of works this way, but we don't usually use, you know, at least in the United States, we don't use humans. We actually use animals to fulfill this, right? And a lot of times we use mice, right, to do that, right? And so it's a adjusted version of it, you know, but again, that doesn't work on the, you know, the front end of things, right? Or you know, the healthcare side of things, right? But still good, because we do use a version of this to identify then a particular pathogen or an infection tied, or pathogen tied to an infection or a disease. Okay. We transmit, continue to talk about how pathogens get transmitted, right? And so when we talk about a reservoir, this is an animate or inanimate object, a living or non-living thing, right, where the pathogen is naturally found, right? This could be animal, human, also could be water, or soil, right, etc., right? Animate, inanimate, right? Reservoirs, right? And sources, right? Okay. The place where we get them from actually helps us to understand, you know, how this transmission happens with infectious agents, right? So when we take a look at sources, right? And so we can identify sources as being endogenous and exogenous, right? Endogenous means that the pathogen comes from the host's own body, right? So we have its pathogen coming from its own body. And exogenous means the pathogen is external to the host, comes from somewhere else other than the host itself. Okay, so what do we mean by this? Exogenous sources, for example, can be environmental, right? Outside sources. Here's your soil or water. But in the medical side of things, maybe equipment, food, right? Animals are an exogenous source. Other humans are exogenous sources, right? When we talk about an endogenous source, comes from the same host, right? Look at that. Normal microbiota that are found in a certain system of the body, a certain area or the region of the body, can be taken to other places and can cause infections, right? Okay. So they give you a great example, right? Skin microbiota, skin bacteria, for example, can enter surgical incisions and can cause infections inside the body. And again, those are harmless to us if they're on the outside of the body. But once they enter into the body, then we see possible infections, right? And then, of course, opportunistic pathogens, right? Okay, so taking, hosts from one place to another. This is just another version of that, right? And they give you a example of that as well. Okay, the mode of transmission, right? Mode of transmission is how the pathogen spreads to the host, right? So there's different modes of transmission, but generally they fall under these two branches. If you're a direct mode of transmission or indirect transmission, right? And this figure 9.1 in your book, talks about direct versus indirect, right? Direct means the direct contact between the pathogen and the host. Direct contact, right? This one's an easy one to understand, right? Person to person, right? Person to person skin contact, mucus contact, mucosal contact, right? Saliva, touching, right? Sex is person to person contact. Animal, direct transmission, right? Scratching, biting from one animal to another, animal to human, right? Environmental, right? Taking, again, the host, the human, and interacting it with an environmental source. Swimming, soil does that, right? It's good examples of that. And vertical direct contact transmission, right? And so we see this commonly, for example, between one host and the other in a specific type of situation like, pregnancy, right? So we talk about that. In utero, vaginal delivery, breast milk, all of which are vertical, right? Mother to child, which can happen, right? And so when we talk about indirect contact transmission, we can do this through the air, right? No direct contact, but we get a pathogen from another host indirectly, right? Airborne. Vehicle transmission, right? So introducing the pathogen to a host through a contaminated object, inanimate object, right? Like food, needles, contaminated water, that's a vehicle transmission. And what I like to think of a type of vehicle transmission that is living is called a vector, right? Right? And a vector, biological vector, again, like a mosquito, a tick, or a flea, bites human and actually carries pathogens in itself, not knowing that it does have that, and carrying on through its, feeding process. Will bite somebody else, introduce the pathogen to the host, and so we see this as a contact transmission, indirect. And so when we talk about mechanical vector transmissions, these are also living, but they do this a little bit different, right? They don't introduce stuff to the body in the form of biting per se, but they do land on objects or land on yourself, and then that's actually how we can actually get the pathogen. And flies do a great job of this, so do cockroaches, right? That's a type of indirect contact transmission. Okay, so what I want to talk about here is the 5 stages, really, of disease that occur in an infection, right? And before we talk about that, I want to define these words right here: infectivity, virulence, and pathogenicity, right? infectivity really talks about how good an infectious agent is at establishing an infection, right? How good it is at establishing an infection. How well it does that, right? Once it does establish an infection, we talk about the virulency, right? And that's how severe the disease is following the infection. And then when we talk about pathogenicity, we really discuss the ability of an infectious agent to cause a disease. Its ability, right? Okay. And what it has that makes it very able to cause an infection, right? Okay, so having said that, having using those terms here, I want to talk about then those stages, right? Incubation period, prodromal period, acute phase, period decline, and convalescent phase, right? Possibly the immune system here coming into play, right? So we could probably see that as well, right? And the prodromal phase, we start to see a rise, if you will, in the pathogen level, and that's really because the pathogen is starting to damage cells, start to reproduce, and then reproduce in numbers, and so we see this increase in numbers in our body. The immune system is starting to fight these battles, but for right now at least, the organism is somewhat winning, if you will, right? And so we start to see in the prodromal phase early symptoms develop, right? And the symptoms start to progress, right? Start to get more severe and more severe. And then the acute phase, right here, is where we see a real big rise in infection, right? We see a lot of pathogens being reproduced in the body, right? And then we get to a peak, right? And the acute phase is where you really start to see the peak of the graph, where the greatest number, let me draw this here, the greatest number of pathogens is seen in the body, right? Right here in this part, right? So that's the acute phase, right? Peak of the disease, right? Immune system is still trying to fight the infection, and so we see that there as well. And then we start to see a fall, right? So we're seeing this fall, if you will, of the pathogen in numbers, and that's really because the immune system is beginning to win the battles here, right? Okay, it's brought it under control. There's more death of those, in those pathogens than there is replication, right? And so because of that, symptoms, right, we're starting to resolve. We're getting better, right, if you will. We're getting better. And in the convalescent phase, then, the last phase there, the patient recovers, okay, somewhat back to normal, right? But if you'll notice, and the reason why it's kind of left right here is because sometimes that graph flattens out, right? Which tells you what? What should this tell you here? Well, that should tell you that there is still pathogens in the human body at this point. Because there's pathogens in this at this point, depending on what type of infection people that have recovered from an illness are still infectious, right? They can still transmit the pathogen from one person to another. And so this is one of the points that many people do not understand, and they need a good bit of clarification. And this is kind of where, hopefully you play a role later on in your career, educating your patients about the convalescent phase, right? The part of which where you might feel better, right? You might feel good. You might be ready to go back to work or go out in public. But the issue is you're still highly infectious in many cases. Great example of that is the flu. Right? So the flu depends, but 4 to 5 days is where you actually see the flu progress, and during this stage 1 to stage 4. Stage 6 through sometimes 9 or more is really stage 5, right? It's really convalescent, which means you're still infecting. You can still potentially affect people with the flu past these days in the convalescent phase. So a good bit of education is needed for patients, where we tell patients you need to stay home, right? Even though you feel better, stay home. It's either you stay home, or sometimes if your children are sick, they need to stay home and not taken to schools, daycares, and things like that, because this is how we can actually spread disease pretty quickly, right? Okay, so again, sometimes the host harbors the pathogen indefinitely. Sometimes that's the case too. Or the pathogen can exist in that latent state, right? You can be a chronic carrier, which means you're asymptomatic for a long period of time. So you won't have symptoms, carry it, right? Okay, so let's talk about this, right? Some more epidemiology specific part of the chapter, right? So epidemiology is the study of what is upon people, right? So the things that cause diseases, right? More particularly, right? And those can be infectious or non-infectious, right? They can be caused by pathogens or not caused by pathogens, right? But it's overall diseases that cause illness, right? So again, I mentioned that it's not just pathogens causing the infections, but other underlying diseases or disorders that are of particular interest to public health, right? And that's really the study of epidemiology. So what are the goals of epidemiology, right? To describe, right? To understand, to know the information about the nature of a disease, the cause of a disease, the extent, right, of a new or existing disease in a population, right? So this is education, right? Right. And the second one, which I think, education is important, but what you do with that education is number 2, right? Intervene, right? This is where you come in, right, into play as a clinician later on, right? You intervene to protect and improve health in populations, right? And most of the time, intervening basically, to me means education, right? Educating, right? Educating those patients, right? Educating those patients, right? So education is a nice preventative. So if we can educate folks and being healthy and prevent them by that education from, causing harm, causing an infection, etc., you improve health, and they don't have to visit your doors for remedy, right? Okay, so when we look at epidemiology, we know it to be a triangle, right? Epidemiology is a triangle, and the 3 sides of the triangle actually encompass epidemiology, right? So what the host has, right? The factors of the host, what's going on with the human, right? Let's say we're studying just humans, right? Their general health, sex, lifestyle, age, ethnicity, occupation, many other demographics here, right? The agent in question, right? The one that's causing a disease, the etiological agent, right? And the environmental factors, right? Things like climate, location of the host, and the agent. The ability to transmit the vector of vectors transmitting, water, food, soil, etc., right? And putting these three together gives us then a picture of the disease. So a lot of times we take a look at the environmental factors more so than the etiological agent, right? Yes, that's important, knowing, you know, if it's a bacteria or a fungus or a virus, you know, etc. Yeah, that's important. But more so than anything else is the environmental factor, right? Those environmental factors that the host interacts with or is found living with play a huge role, and I think much bigger role than knowing than the agent, right? Agent's important to know, but the environmental factors, right? Again, environmental factors. We can write a great example because we're about to get into this, right? This part of the year, right? You get in this part of the year, we know that host goes all right. All right. As examples. So you can list, you know, if you wanted to list this even more as an example of understanding how this works, I would say that would be a great idea to do for studying, right? But, you know, just the top of my head, what do we do in the summer usually? We swim, right? A lot of people like to swim, or at least we get, you know, near bodies of water, right? And of course that has to do with the outdoors. A lot of us are, you know, go to the outdoors. Since the temperature's warmer, there's a lot of camping involved, a lot of, you know, barbecuing outside, rivers, lakes, etc., picnics and what have you. And because of that, we interact with each other much more in the summer than we do in the winter, right? Okay, since it's warmer, we get to interact with a lot more people, all of which can lead to different types of, you know, infections, right? And that's really the purpose of this activity, to understand, again, environmental factors play a big role, right? Okay, many pathogens have a limited host range, right? Okay, so many pathogens only infect a certain host, right? And not infect many hosts, right? Because we see this as the case, right? That's actually a positive, but we also know that pathogens can evolve, right? They can change, and because of that, their host rate can change, right? What type of host they can infect, right? And then when we look at the host itself, the factors itself, again, play a huge role, right? Again, how healthy the person is, their age, their nutrition level, you know, right? So this is a great example, right? You find a normal, healthy person, let's say healthy human, right? An infectious host cannot affect us, right? We can fight it off, or we can not even notice it's there. But if we change the host to one, let's say, that's more immunocompromised, like these three, then we can cause you know, extreme illness or death here, right? That's why newborn babies are quarantined or sequestered away from the public for at least a month. You know, that's a good range. You know, again, some people do that earlier, some people do that later. You know, a month is not this, you know, complete standard, so don't take that as the, but that's a good time, right? About a month before we start to introduce the child in there. And why? Because babies are immunocompromised, right? Not by a disease, not because it's a disorder. It's just because, you know, they're infants and their immune system is growing, right? It's still in development stage, and will still continue to be development stage for a good while after a month, by the way. But, you know, as far as their first and second line of defense, that's what we're talking about as far as developing, right? If you remember the third line of defense, that's your adaptive immune system, right? That'll be your one that is we pick up, for example, when we get vaccines, right? That helps us with our third line of defense. But we're talking about our first and second line of defense, right? Your innate, right? Immune system. One we were born with, but the one that we actually develop a little bit more past, you know, birth, right? The elderly, right? We know that the elderly, just because they are elderly, just because of their age, already sets them down as an immunocompromised host. And why is that? Because as we age, cells start to not function correctly, cells start to die or lose in number, and then those cells then, you know, are part of the immune system. Will henceforth we have, you know, immunocompromisation, right? And organ transplant recipients, right? When you transplant an organ, we have to lower the immune system to do that. And when we do that, we, you know, make the person immunocompromised, right? All of it can cause serious disease. So again, when we look at what the host interacts with, what the host behavior is, right? You know, personal habits, activities can lower the risk of developing, right, diseases, right? And one of the biggest ways, one of the easiest ways we teach, you know, others, right, is hand washing, right? Just by hand washing, we can actually lower the risk of many types of diseases just by doing this, right? We saw this, for example, in the lab at the very beginning of this course, right? You know, IV use, intravenous drug use, using needles, for example. You know, that's a personal activity, right? Personal habit and activity. And this one, believe it or not, right? Clean drinking water. That's really important as well, because we know that water is a great vector for pathogens, right? Okay. And again, here's the key, right? Really, epidemiology is about prevention, right? Intervention versus, you know, intervention in the form of prevention, right? Prevention is better than having to treat the disease, and that's absolutely important, right? You know, if we can prevent it, we don't have to treat it, okay? And prevention is key, right? Prevention is everything in healthcare, right? Prevention is one of our most important tools in healthcare, right? And we know this for a fact, right? That should give you evidence that prevention is key as well, right? Because not all infectious diseases are curable, right? Currently, right now, that is not curable. Hepatitis, right? And certain types of hepatitis is non-curable. And we can go on and on. So there can be many different, you know, infectious diseases that are not curable, right? And you can add to this list. Again, this can be a great way to study, to learn how this works. Okay? So again, education is really important. That's probably the number one thing here to break that triangle, right? The epidemiological triangle, right? Education is I guess the cheapest, the most efficient, you know, in terms of money and time, is education, right? But we also use quarantine, right? Quarantine's an effective tool to use here, and we'll talk about that also. And vector control, right? Controlling the vectors per se can control then infectious diseases, right? And there's, okay? Again, public education central, right? So we see this a lot in our towns, cities, you know, counties, state, country information, right? When we talk about vaccinations, right? Right? So get your vaccination. Make sure your child is vaccinated. The vaccine schedule is this. By this time, you know, by 3 years old, you should have this vaccine, so on and so forth. So there's an intentional reason why, is because we're educating our public, right? Okay. The promotion of prenatal care is really important, right? Okay. So making sure we take care of our children even before they are born, right? In utero, inside the mother's womb. And then after they're born, promoting breastfeeding. Breastfeeding is really important because this is actually how we transfer some of the immune system from mother to child, right? All right. And so, you know, antibodies are one of them, but there are some other types of immune system cells that mothers then through breastfeeding transfer, right? So that actually helps out a whole bunch. And of course, the nutritional value in breastfeeding as well, but the immune system side, you know, that's really important also. Okay. And then here's a great example too, right? It's, you know, that right there, right? Sex education. Super important. And we really talk about, you know, sex education is very much about prevention of these sometimes really quite damaging and sometimes deadly sexually transmitted diseases or sexually transmitted infections, right? Okay. This is also really important, right? Public health education helps people understand their role in preventing the development of drug-resistant pathogens, right? All right. Take your antibiotics and take all of them, right? And why is that the case, right? Why is that a really important thing to tell a patient, right? Because not taking the full round of antibiotics. So if they give you 20 pills and they ask you to take your 20 pills completely, you're supposed to finish the bottle, right? Finish your bottle of antibiotics. And why? It's because you can actually develop resistance bacteria there. You can have a secondary infection, a re-emerging infection again, and can cause drug-resistant pathogens to form, right? So we talk about quarantine, right? Okay, this is a period of confinement away from the general population. Again, you know, we like to see these movies where these, you know, communities or a city or town is quarantined. And yes, that's, you know, being quarantined. That's an example of quarantine. But, you know, for example, if you had the flu, this would be a type of quarantine, right? Staying at home, right? That's self-quarantine, right? Or a doctor would say you need to stay away from the public. Stay at home. Don't go out for at least a week. And that's an example of quarantine as well, right? And the key word is short, right? A week is short. 6 months is not short, right? So long incubation times. Again, that might be humane, unethical, right? So some organizations like the Centers for Disease Control have the capability, because it's the federal government, has the capability of quarantining any person entering or sometimes already in the U.S. So they have the capability of doing this, right? Okay, they have the power to do this, right? And so there's a list here. You don't need to know this list, but unless you're working with the CDC, you would have this list. But these are really, really a lot of a hot list of really pathogenic and sometimes deadly. Many of them are deadly diseases, right? Okay. So again, depending on where you're coming from and what part of the world you're coming from into the United States, you can be quarantined, right? And interviewed and purged, basically, right? So they ask you where you've been, how long were you there, who did you interact with, etc., because the CDC knows, the Centers for Disease Control knows, and works with the Department of Homeland Security to make sure that this, that you don't come from a person, you didn't come from a place or interact with a person that might be from a place that has a prevalent amount of any of these particular diseases, right? And so sometimes, on occasion, depending on where you're at, they can take blood draws, so they can actually look at your blood and make sure that you don't have this infection. But again, it's just protecting. It's a preventative, preventative action to protect the public, right? The rest of the public in the United States, and that's really what this is about. It's not really to take away your human rights. It's to protect the rest of us around, right? Okay. All right, so here's the areas of quarantine. These are the places that we quarantine folks, right? Where they have the capability of quarantining people. And again, if you come into a location that is, from the outside of the United States, this is usually where you're entering, right? You're usually flying in. So there's not direct flights into the middle of the country. They're usually direct flights into, let's say, Los Angeles from the West Coast, or New York from the East Coast, all right? Or if you're in the Caribbean, Houston first. Those are influxes. Those are checkpoint stations for places that you go into, and then go from there to other places on your way into the United States, right? Okay, so again, public health is it's found everywhere in a developed nation, right? That's why you see those signs: employees must wash hands in a restaurant, right? In any place that they serve the public. In fact, there's a law for that, right? That's why that's there, right? Many a times, we have to mandate vaccines, right? We've seen this issue going on right now with measles, okay? And that's usually isolated to areas or locations where they're going to have a small group or small community that is isolated away from the public. And because of that, they practice anti-vaccinations, and that's where we see these blooms coming from. But when you interact with the public, many times states mandate that the person gets vaccinated, right? Or they can't attend school, for example, public school, or so on and so forth. So there's a limit to that, but we try our best to mandate that without violating civil rights, right? Okay, so again, the monitoring and regulation of public health is usually seen at the national level, regional level, like the state level, local level, like a city or a town, right? The CDC is that federal agency. They fall under the Department of Health and Human Services, or HHS, if you've seen that before. That's where the CDC fall under. And that's the central source, at least for the United States, of epidemiological information. So you as clinicians, if you ever wanted to do some, you saw a good bit of, I don't know, cholera come through your doors and want to know why or how much that should normally be in the United States or from that area or that region, the CDC is a source. You go to the website and you can actually have a wealth of information, and many of you already did, looking at your papers and okay. So this health system again can investigate, can diagnose, prevent, because it reduces the health problems, right? They monitor, right? All of those things. And all the data, all the information that they have is good and available for the public health, right? It's all an open gate where information is shared back and forth. And that's really the goal of that. That's really how this works so well, is because there's an open door policy to share this information between cities, towns, counties, states, and the, many states in the nation overall. Because this is really how this works, right? Okay, so let's we're gonna kind of jump around here for just a little bit. I want to kind of try to finish this in some time, so we'll get to some of this stuff, right? Okay. So epidemiological studies, right, actually use statistics, right? This is why, for example, you study statistics, not only because of calculating medications and what have you, but looking at statistics, right? Looking at this math, if you will, that talks about, rates, ratios, proportions, right? Rate is the measurement of the occurrence of an event over time. How many times did this occur, right, in a given time? The ratio is the occurrence an event of one group versus another group, right? That's the ratio. Okay, and the proportion is the percentage of a whole, right? Okay, and those are, again, tools to use for looking at epidemiology, right? Okay, so what is a population? It's any defined group of people, right? So you can define that even more, right? The group of people in Southwest Texas, right? Or the group of people that live in a certain area of Uvalde, the city of Uvalde, right? That'd be a population amongst the population, right? And so what is the morbidity, excuse me, is the disease in a population, right? Morbidity, right? Morbidity is different than mortality, right? That's the death rate, right? But morbidity is where you see this disease in a population, right? And the prevalence is the existence of the disease or morbidity in a given population at a specific time. That's the prevalence, right? That's the prevalence, right? Okay. So incidence rate, right? The key word is number of new cases, right? New is the key word there, but the statement is number of new cases in a population in a defined time, right? Number of new cases, that's the incidence, right? The duration is how long the infection lasts, right? And you can see this from the graph here. This is measles, for example. We're looking at measles, how much measles, right, over a given period of time, right? And you can see right at about 1963, I believe, is where the measles vaccine was invented, right? Right about there, excuse me. Right about there. Okay. You can see that measles, for the most part, if you took a look at the graph here, draw a line straight across, a lot of measles out there, right? This is thousands, right? That's 800,000. That's 500,000, 450,000, for example. And it rise and fall. So that was a good amount of folks, right? Before let's say 63, right? When the vaccine gets licensed and made and then distributed out to the public, and the vaccine gets used, guess what happens to the population, or the number of measles cases that you see, right? over a short amount of time, a couple years, goes down to almost zero. And then for the next couple of decades, it is almost or at zero for a long time. Right? Amazing to look at, right? How vaccines work, right? In the public health. Well, if I took a look at this graph here, and this was 2015, 2018, we'd start to see this kind of thing. A little bump there going up, right? And why is that the case? Anti-vaccination, right? That's what we've been looking at this. Okay, so when we take a look at that data, we actually calculate measures of association, right? What factors are linked with the disease and who might be at risk, right? That's association factors, right? Association measurements, right? This gives us information that we can actually give out to the public, right? It gives us a warning, right? Lets us warn folks to, you know, don't do this because this can lead to that, right? This particular disease, right? All right, so we look at graphs here. This graph here is actually a bar graph showing you then different populations, right? White, non-Hispanic, black, non-Hispanic, Hispanic, right? Mexican American, and looking at HSV2, right? It's a virus, right? And we see that they're occurring, right? Depending on the number of partners, right? And we're talking about sex partners. What we're talking about is a sexually transmitted infection here, right? In fact. And we see that depending on what ethnicity you are, right, and how many sex partners you had can lead to an increase in this viral infection, right? And so we can even go back a little bit further and look at how does this work in each of these communities? Where are these communities found? Is there anything that leads them to actually have this increased risk of this infection? So we see that also in this graph. So you can actually tease this out. You can actually add more information on here, right? Could be education levels. There can be a lot of things that you can pull out of this graph, but that's why this data is here, right? To really take a look at all of this, right? We see, for example, one thing that's common in all populations here is the more partners you have, the greater your chance of getting this infection. That's true in all populations, right? Which is one thing we know for sure, and that's one thing we say, okay, practice safe sex, right? That's one thing we know for sure, right? Looking at associations can uncover risk factors, but just because two things occur at the same time doesn't make them linked to each other, right? The correlation, the actual chance of them both happening together doesn't imply that they're both linked to each other. That's really what that means, right? And correlation does not imply causation, right? Causation. Okay, so there's some great examples here. In the 1920s and 30s, we had a new invention. I don't know that refrigeration, right? This new process of refrigeration, right? That only, of course, the rich can afford, but then over time it becomes more affordable for everybody. But refrigeration started to come about. And because the refrigeration comes about, we start to see the ice cream being sold, right, to the public. right? Ice cream vendors, right? Your ice cream, truck coming by and giving out ice cream. So one of the first claims out, because we start to see polio come around a whole bunch, right, was that the fact that because of refrigeration, the availability of ice cream, we thought that that was linked directly to polio. That if you ate ice cream, for example, more frequently, you would have a chance of getting polio. And again, it just so happened that these two were very popular, or ice cream was very popular at the same time. We saw a lot of incidences of polio, right? A lot of new cases of polio. Again, correlation doesn't imply causation. So we may think that's kind of silly, but nowadays, right? Here's one that we still see that comes around. That's a great example of correlation and causation, right? Okay. We see autism rates increase over time recently. And because of that, we think we'd link that to vaccines, because vaccines, the new invention of more vaccines or different vaccines has increased over time. Because of that, we're taking more vaccines than we ever have been. And we tried to link autism again to vaccines, right? Because we have more incidences of more incidences of autism, we think that that's because it's directly correlated with vaccines, and that's not the truth, right? Research does not show in any situation over many years that taking vaccine leads to autism. Okay, but the question is, there's an increase in autism, but we still need to figure out why. But it's not from vaccines. Okay, that's just the science tells us, the research tells us it's not from vaccines. What it is, what's causing the increase of autism, that's a good question. Okay, so I'll move here with different types of epidemiology and what have you. So we're gonna move on. Right? That's right, hospital epidemiology, because that's what really matters to a lot of you, right? Okay, hospital epidemiology involves really looking at preventing this big, huge issue in hospital care right now, HAIs, or healthcare acquired infections, right? So this is a disease that comes from any type of healthcare facility, any kind of intervention, right? Any kind of facility, for example, a hospital, long-term care, outpatient, nursing homes fall in one of these groups as well, because they can be both long-term and outpatient. But yeah, infections that come from those areas, right? And so we've got to look at and we've got to document those very well in a hospital setting, in a healthcare setting. Those diseases that we know to be HAIs, and what we've done or not done to actually prevent those, right? So this is interesting to note. Increased by 40% from 1975 to 1999, right? We saw a huge increase there of HAIs, right? Okay. Because of that, the CDC took a look at it, started to create initiatives for that, or practices or protocols, procedures in place for the healthcare facilities to abide by to make sure we reduce HAIs, right? So just some stats, right? These are current stats, by the way. 1 in 25 patients develop an HAI. Might sound like a low number, but that's actually, pretty substantial still, right? Around 75,000 people die from HAIs, and it costs us about $35 billion a year, just HAIs alone. All right, so not only is it, causing death, but it's also causing, us, a lot, right? So here are some common HAIs that we see in the healthcare environment, right? Medical devices are one, right? Okay. So we see that, right? Serves as a way for pathogens to enter into the body. One of them being like devices that are inserted inside a patient, right? Catheters for one. Central lines, right? That could be a place infection, right? This one's a huge one, right? Hospital personnel, right? Not washing hands, not having good hygiene, right? Can actually cause an HAI, right? This one's a huge one. For those that work in a healthcare setting, already know about C. diff. That's a GI tract infection. All right, C. diff is a very common HAI, right? That we see, right? UTIs, right? We see commonly, right? Is an HAI. Infections of a surgical wound, right? MRSA is a big one, right? IVs, right? Respiratory infections like pneumonia because of the device like a ventilator, right? A lot of those places, right? And these are common places, common stuff that gets used in a hospital setting, right? Okay. There's a breakdown. I believe this is from the CDC of where we get the HAIs as far as percentage, right? There's a pie graph, right? Most of our HAIs that we see come from C. diff, right? Almost, more than half, sorry, not almost, but more than half. A good majority of them are from catheters and UTIs, then surgical, central lines, and then MRSA is the last one. Okay, so here are the bacteria that cause most of the HAIs, right? Staph aureus. This is actually MRSA, right? E. coli. That's GI. C. diff, GI. And Pseudomonas. See that coming more than anything from the skin, right? Right, skin infections. And all of these are, or at least strains of them, are becoming antibiotic resistant, which is an issue, right? So we see this here. This table really takes a look at all the HAI pathogens, right? You're not going to be tested over this, obviously, but, it's good to look at to kind of understand how these all work here. Okay. So we estimate from the CDC that 70% of the HAIs are preventable, right? They are preventable. And it's just practicing good technique, good hygiene, good aseptic technique. Those are where we actually, is where the prevention comes in, right? Okay. So a good hospital, good healthcare facility will make sure that they have a monitoring system, a surveillance system for those HAIs, right? We monitor transmission patterns. We look at them in a healthcare facility, make sure we study those well, and then track those back to see what the healthcare facility might be doing wrong or doing right to prevent HAIs, right? Or HAIs. Again, what's the number one, biggest impact to reduce HAIs or any infection? Hand washing. Right? In theory, simple to do. In reality, can be difficult, right? People forget a lot. Humans forget a lot, right? So hand washing is the biggest one. But gloves, right? Protective wear, that's important, right? PPE, right? Personal protective equipment, right? We talk about PPE, right? This one's huge too, right? Environmental sanitation, This This is your maintenance folks. This is your housekeeping folks, right? These folks are crucially important. If you work at a healthcare facility, please make sure you thank these folks and let them know and educate them that they're a crucial part of this this group here, right? Crucially important for this overall health and healthcare facilities, right? Sterilizing equipment, isolating patients, preventing them to be, transporting from patient to patient frequently, different floors, different, rooms, using equipment just for a single patient, right? And again, isolation can be. Just because we talk about surveillance programs here at the end, talks about some of those situations here, right? Kind of go information, but